first introduce you, David Penniman, and David is the financial analyst doing financial reporting and analysis for Reliant Medical Group, and Ifrad Islam, and Ifrad is a manager of managed care and finance. Both are alums of our college and universities, and I did not know that walking into the show, but Ifrad, Clark University grad,
yep, that's right.
And David, MPCHS University.
Yes.
Yeah. So David, maybe you could tell us about Reliant Medical Group and kind of all the things that it does.
Sure. I mean, at a high level, Reliant's an outpatient practice, physician group. We have about 2,500 employees. We service 300,000 patients across Worcester and surrounding suburbs.
Yeah. And Ifrad, as someone who's a manager of managed care and finance, maybe a little bit about that, and then how the two of you are part of a group working on this whole pipeline issue, workforce pipeline.
Sure. So from a business standpoint, Reliant is kind of uniquely positioned because we work very closely with insurance companies to make sure that we're coordinating the care of our patients and that our patients are healthy, and then that we're sort of keeping very, very close track of the way they're utilizing medical services. So what that means is that there's a very, very acute focus on data analytics. So David and I, being part of the healthcare finance team at Reliant, we're always looking for bright people to come join us into a financial analyst role, and especially people who are looking to grow their career in healthcare finance and stay with Reliant and in Worcester for a very long time.
So you don't have to be a doctor or necessarily medically trained. There's
right.
a whole business end of this operation.
Exactly.
Absolutely. Yeah, I mean, healthcare being the epicenter of big data nowadays in research, we need people who have that kind of conceptual mindset and those soft skills really that are required in data analytics.
Well, people love kind of the stories. I think, I'm just curious how both of you went from a local college and university to Reliant.
Sure. I mean, so my story is a little unique. I started out in graduating from MCPHS in Boston, and I was seeking a healthcare finance profession afterwards, and really I couldn't, looking at the local housing market, I knew I could not afford downtown Boston. So, through research, I kind of stumbled into Worcester, and, it might sound cliche, but the accolades from, Becker's Hospital Review from Reliant is kind of what really drew me to the employer.
Mm-hmm. And Ifrad?
Yeah, I graduated from Clark University. I spent 6 months in Providence working for National Grid, and then I decided that I really wanted to move back to Worcester because I'd already spent 4 or 5 years in Worcester, and I really, really liked the city and the unique characteristics that it comes with, and the cost of living, as Dave said, is always a really, really appealing factor. Then I found Reliant Medical Group, and actually what drew me to it is the alumni community from Clark University who actually work at Reliant Medical Group and keep the place running. So they're the ones who kind of started recruiting me and taking me in. I got an interview, and things just got better from there.
Right. So there's a couple common themes here, kind of the cost of living, a familiarity with Worcester, some good reviews on your end, David. So as you kind of go about, from your own experience and then kind of working it with the Reliant Medical Group team, I mean, how are you kind of going forward in terms of that strategy of reaching out to companies, to prospective employees for the company?
Sure. I mean, we have kind of two approaches. One's more traditional, where we're very much involved in college career centers. The career center people are great. They're very engaged when they see an employer actively looking. We're used to going to career fairs, especially at Clark University, for example. And we also get a lot of referrals. So, I mean, our latest hire in finance was actually referred to by the chair of economics at Clark. So that kind of dynamic.
Yeah.
So
Brown, John?
No, it's Wayne Gray.
Wayne Gray. Yeah, all right.
The important thing to note is that despite your relationship with colleges, it doesn't really always result in a large volume of applications, because as we know that there's a brain drain issue in Worcester. Yeah. We're finding that a lot of students who are getting trained in the area are actually moving out of the city in order to go to the more conventional hubs.
Well, if it makes anybody feel any better, it's a challenge we have across the state in Massachusetts, but certainly we want to, in Worcester, with the high concentration of college, universities, and students, we want to move that needle. Yeah,
absolutely.
Yeah.
And we strongly believe that the way to do that is to get inside the college classroom And therefore, we're actually developing a program as we speak that can be integrated into a college curriculum, where we can actually go in and talk about healthcare administration with students, sort of talk about our own experiences with our careers and with the local industries of Worcester, and actually run some simulations that can, give some insight to the students into the world of healthcare and how the market dynamics work. Really get them interested in, what we do on a daily basis, so that they actually consider some of the great healthcare companies that are in Worcester before they start looking outward.
Yeah, and when you look at the Central Mass economy, the four major sectors of the economy, it's healthcare, it's higher ed,
Right.
it's financial services, and manufacturing. And when you say Reliant Medical Group, there are probably certain connotations or kind of predispositions that pop up in people's mind about what that company is. And maybe some people might say, there's nothing there for me because I'm a finance
Right.
major, when really nothing could be further from the truth.
Absolutely.
So a lot of it is kind of breaking that down. And one of the major chamber initiatives that we have pursued over the last several years is try to be much more aggressive in encouraging our companies to create internships so we can get people off campus, understanding that there are great companies like Reliant Medical Group and others around where they don't have to go to Boston or New York
Yep.
or other places. So in addition to kind of the career fairs and trying to reach out with to the classrooms, anything else technology-wise, things you're doing that are kind of cutting edge, or is it just kind of pounding the pavement?
We have a revolutionary care delivery model, which I think is very interesting for anyone really looking to really engage themselves into a career after you get out of school. Our work is very invested in sort of understanding health policy and really wrapping our minds around sort of how healthcare has evolved in the United States over the past 50 years or so. And we have an acute focus on patient care and making sure that we're not only concerned about bringing patients in and seeing them as many times as we can, rather really focus on the population health in the community, which makes the team that we work with, we have a team of about a dozen people in healthcare finance at Reliant. They all live and work in Worcester or surrounding towns. It makes your work that much more meaningful when you know you're directly serving the communities where you reside.
Yeah, where you're working.
Yeah. And, I think our finance group, being very local, we also span the 7 colleges in Massachusetts. So anywhere from UMass Amherst all the way to BU. So it's kind of the whole gambit.
Yeah.
Yeah.
So a good cross section.
Yeah.
But interesting. Reliant Medical Group, part of kind of this new paradigm where it's about kind of wellness and prevention and kind of the data, using that to inform how do we deliver, and then ultimately both insurance companies and the federal government, state government rewarding kind of wellness.
Right.
Yeah.
Exactly.
So a new concept and data and information all about driving those decisions, and you hear the governor talking about that and
Yep.
others nationally. So it's great to see you guys are ahead of the curve, and thank you for joining us, our guest. At some point we'll have you back and we'll talk a little bit more about the progress that Reliant Medical Group is making.